6 small balance changes that may signal your body needs help. After 50, most people think balance problems begin with a fall, but that is not usually how the body warns you. Long before someone falls, breaks a hip, or starts avoiding stairs, the body often sends smaller clues. A little unsteadiness when turning, a hand reaching for the wall, a strange feeling when walking in the dark, a slower step off the curb, a moment where your feet do not feel as connected to the ground. And this is where people get fooled. They say, "I'm just getting older." But after 50, small balance changes should not be ignored, because balance is not controlled by one thing. It is a teamwork system between your eyes, inner ear, muscles, joints, nerves, blood pressure, brain, and even your medications. The National Institute on Aging explains that balance problems can come from dizziness, vertigo, lightheadedness, medications, inner ear problems, and other health conditions. So the goal is not to panic. The goal is to listen early. The first small change is needing to touch walls, furniture, or counters more often. At first, it may be so subtle you barely notice it. You walk through the hallway and lightly brush the wall. You stand up and place a hand on the table. You go down the stairs and grip the railing tighter than before. Most people miss this because it does not feel like a symptom. It feels like a habit. But that little hand reaching out can be your nervous system saying, "I need extra information." After 50, the feet may not send position signals as sharply. Vision may be less reliable in dim light. Leg strength may decline. Blood pressure may dip when you stand. And if several of these happen together, your body naturally looks for support. That does not mean you are weak. It means your balance system may need training, testing, or attention before a fall happens. The second change is feeling less steady when you turn quickly. Walking straight may feel fine, but when you turn around in the kitchen, pivot in the bathroom, or change direction suddenly, you feel a little off. This is important because turning requires coordination. Your eyes, inner ear, feet, hips, and brain have to agree quickly. If one part is slow, you may feel a brief sway, a stumble, or a need to pause. This is where it gets interesting. Many falls do not happen during dramatic activities. They happen during ordinary movements. Turning, reaching, stepping back, getting up at night, or rushing to the bathroom. If turning has become slower, more careful, or less confident, do not ignore it. That may be your body asking for better strength, better vision correction, medication review, or an inner ear evaluation. The third change is feeling unsure in the dark. This is one of the biggest clues. If you feel steady in daylight but unstable when the lights are off, your body may be relying heavily on vision to compensate for weaker signals from your feet, joints, or inner ear. Your feet are supposed to tell your brain where the ground is. Your inner ear helps detect motion and position. Your eyes confirm where you are in space, but if foot sensation is reduced from neuropathy, diabetes, vitamin B12 deficiency, back problems, or aging-related nerve changes, darkness can reveal the problem. Most people say, "I just need a nightlight." And yes, a nightlight is smart. But the deeper question is, why does my balance drop so much when my eyes cannot help? That sounds small, but it matters. If you are more unsteady at night, use good lighting, remove loose rugs, keep a clear path to the bathroom, and talk to a clinician if this is new or worsening. The fourth change is your steps becoming shorter or wider. Sometimes balance trouble does not feel like dizziness. It shows up in the way you walk. You may take smaller steps. Your feet may spread farther apart. You may walk more slowly across parking lots. You may avoid uneven ground. You may look down more often. You may feel less confident stepping off a curb. This is where people get fooled. They think walking slower is only a normal part of aging. But gait changes can reflect muscle weakness, arthritis, foot pain, nerve changes, vision problems, medication side effects, or fear of falling. And once fear enters the picture, the cycle can get worse. You move less because you feel unsteady. Then your legs get weaker. Then your balance gets worse. Then you move even less. The way out is not to shame yourself. The way out is to rebuild confidence safely. Strength training, balance exercises, physical therapy, better shoes, and treating pain can make a real difference. The fifth change is dizziness or lightheadedness when standing up. This is different from feeling clumsy. This feels like a brief rush, floating sensation, or near-faint feeling when you rise from a chair or bed. One common reason is a drop in blood pressure when standing. Dehydration, blood pressure medications, heart rhythm issues, diabetes-related nerve changes, and other conditions can contribute. This is where people get fooled because the feeling may last only a few seconds. They sit up, pause, and it passes. But if this happens often, it can increase fall risk, especially during nighttime bathroom trips. Do not rush from lying down to walking. Sit at the edge of the bed first. Stand slowly. Make sure you feel steady before taking the first step. And if lightheadedness is frequent, new, or getting worse, mention it to your clinician. Medication timing. Hydration, blood pressure, and heart rhythm may need review. The sixth change is stumbling more often over small things. A rug edge, a curb, a shoe, a small threshold. Something you would have cleared easily years ago. If this starts happening more, it may mean your feet are not lifting as well. Your reaction time is slower. Your vision is not catching obstacles, or your foot sensation has changed. This matters because many serious falls begin with something small. The CDC notes that falls among adults 65 and older remain a major cause of injury, emergency visits, and injury-related death, but they are also preventable. Most people wait until after a fall to act, but the smarter move is to treat repeated stumbling as an early warning. Check your shoes, check your floors, check your vision, check your feet. And if one foot drags, slaps the ground, feels weak, or symptoms are one-sided, get medical advice promptly. Now here is the part many people need to hear. Small balance changes after 50 are not automatically a sign of something terrible. But they are also not something to dismiss. Balance problems can come from many treatable causes: inner ear issues, muscle weakness, poor vision, neuropathy, low blood pressure, medication side effects, vitamin deficiencies, arthritis, foot problems, thyroid disease, and blood sugar problems. The National Institute on Aging also notes that diabetes, heart disease, thyroid problems, nerve issues, foot problems, and blood vessel problems can affect balance and raise fall risk. So do not wait for a major fall to take balance seriously. Start with the basics. Make your home safer. Improve lighting. Remove loose rugs. Wear stable shoes. Stand up slowly. Stay active. Build leg and hip strength. Practice balance safely near support. Get your eyes checked. Review medications that may cause dizziness or weakness. And if symptoms are new, worsening, or affecting daily life, ask for a proper evaluation. And please remember the urgent signs. If balance trouble comes on suddenly with one-sided weakness, facial drooping, trouble speaking, chest pain, fainting, severe new headache, double vision, or sudden confusion, seek emergency care. But for the quiet changes, the wall touch, the slower turn, the night unsteadiness, the shorter steps, the lightheaded standing, the small stumbles, listen early. Because balance is not just about avoiding falls. Balance is independence, confidence, movement, freedom, the ability to walk across a room without fear. And after 50, protecting your balance is one of the most powerful ways to protect your future self. Your body often whispers before it warns loudly. The sooner you listen, the more strength, steadiness, and confidence you may be able to keep.